As we come to grips with the coronavirus pandemic, it's become clearer and clearer that many technologies we've talked about for years are absolutely essential to beating this virus. Thanks to social distancing, we've seen incredible demand for video conferencing software, from Zoom Video, from Cisco. We saw that today when we spoke to Chuck Robinson, Squawk on the Street. Even more important, with our hospitals soon to be overwhelmed, doctors are embracing telemedicine. We used to push video conferencing around here with your doctor because it helps hold down the cost of healthcare. But now it also helps stop COVID-19. Every case that can be diagnosed remotely is one less chance for the virus to spread at your doctor's office or the hospital. And that's why tonight we're going off the tape with Amwell, the telemedicine company formerly known as Amwell, that's seen an astounding 27-fold increase in business in the last 4 days. It will only get heavier now that the president said the government's expanding telehealth benefits for Medicare. So let's take a closer look with Roy Schoenberg. He's the president and co-CEO of Amwell. Learn more about how this company is doing and what it's doing to mitigate COVID-19. Mr. Schoenberg, welcome to Mad Money.
Thank you for having me, Jim.
Okay, so Roy, first time on the show and private company. Can you tell us what you're doing in general for healthcare, and then specifically drill down to COVID-19?
Sure. So Amwell produces telehealth technology, which, as you described, is the ability for patients and physicians to get together through some of these devices, as well as browsers and other ways. We serve this technology through many of our clients. Half of them, about half of them, are the health insurance companies, large payers. Everybody's familiar with them: United, Anthem, Cigna. A lot of the Blue Cross Blue Shields have telehealth offering for their membership, historically to not use ERs, and now to avoid the coronavirus.
Right.
And then the other half of the business is actually serving the health system side of the world, where the providers, the clinicians are. And there too, it's the usual suspects. It's Intermountain, Cleveland Clinic, New York Presbyterian. Each and every one of them has a different name for the product that carries their brand that people really trust.
Okay.
But if you kind of follow the packets, it ends up running from Amwell infrastructure.
So how does Amwell make money? And are you, for Corona-19, are you able to even handle the business? The president was talking about how overburdened the telemedicine side is.
Yeah, so I think, making money in peace days is very different than what's going on right now. I think everybody's focus, including ours, is really just to support the rightful transition of healthcare over technology so that people will get less exposure. We serve different clients differently. Health plans are primarily dealing with the mass millions of membership that they have that are very worried about what they need to do, what are the right symptoms, and so on and so forth. But then we also have a lot of health systems that regularly treat elder patients, elder Americans. And these patients don't necessarily need care for coronavirus. They need care for their diabetes and heart failure. And if we can allow that care to happen over technology and prevent those patients from showing up in crowded waiting rooms where a lot of bad things can happen, we can save some lives.
Well, Roy, let me ask you. Before the cell phone, obviously, everything was very different how we treated healthcare. If we always had the cell phone, will we ever really visit the doctor's office, which to me is the worst place in the world to be because you can catch a bunch of diseases when you find out that you're actually healthier than you thought?
Yeah, the truth is that there's a balance. I think we need to think about telehealth as another way in which healthcare can take place. There are some things about healthcare that can happen very effectively through technology, like dealing with simple medication, simple flu, following up on patients who we already know what the diagnosis is, but they need a lot of hand-holding and everything else, helping patients after surgery to recover at home. There's a lot of stuff that can happen through telehealth, but clearly when it comes down to having an operation, a surgery, blood needs to be drawn, a CT scan needs to be done, or, God forbid, you need to be hospitalized. In those cases, you actually do need to go into healthcare. But we can divide the load on healthcare much differently in the world where we have this technology.
We had Mark Casper on last night, who's the phenomenal CEO of Thermo Fisher, and they're going to have 5 million. He says they're going to have 5 million testing kits next week. How is that going to change the way Amwell helps people who fear they have COVID-19?
Yeah, so I think the whole world of testing, has been debated, discussed. That's probably, you don't need me to talk about that. But the reality is that as more and more people are getting access to those tests, we're going to have a whole new kind of worries that people are going to have. Where do I get the test? Should I get the test now? Am I eligible for the test? Am I showing symptoms? Did I cross the line where I need to get the test? And realistically, just to be clear about it, people who are going to get the test, if there's a consideration that they were exposed, for the most part, we're going to tell them go home and stay quarantined. So now you have a huge population of Americans who are at the edge of their seat. They may have been exposed, they may have taken the test, and we're telling them to stay home. If we're not going to be able to allow them to get in front of healthcare professionals, many of them will actually have to break the quarantine and go to healthcare. So we need telehealth not only to deal with the worried well, we need to also envelope and be there for Americans who are going through the progression of the illness in their home in order to actually, move the needle on this.
Well, look, I wish you were public because we only have one right now, and what you're doing just sounds amazing. Private company. I want to thank you so much, Roy Schoenberg, President and co-CEO of Amwell. I wish we could own it. It's private. Thank you so much, sir.
Thank you, Jim.
Everybody's back after the break.
Don't miss a second of Mad Money. Follow @Jim Cramer on Twitter. Have a question? Tweet Cramer. #MadTweets. Send Jim an email to madmoney@cnbc.com or give us a call at 1-800-743-CNBC. Miss something? Head to madmoney.cnbc.com.